as we speak, in the year 2017, given all the advances in the treatment protocols, do the children you see every day look slightly better off in terms of side effects? What is the human condition inside oncology clinics? Is it any gentler?
I would say in the last 5 years there has been, little change and specifically for patients who are receiving upfront therapy, so their first line therapy. And that even though these targeted agents are exciting, many of them haven't been proven as being the most effective right up front. So I would say for most pediatric cancers, the therapies that we use are still, the older style chemotherapy-driven protocols. For instance, in leukemia, now with these genetically engineered T cells, those are still reserved only for patients who have relapsed, who have very high-risk disease and it's come back. And for those patients, it is now, if you had relapsed leukemia, there was a very high risk of not being able to treat it and, of it being a fatal disease. But now with these engineered T cells, we are able to, get almost all of these children back into remission again.
Wow, that's saying something.
Yeah. We're trading some side effects for other side effects. For instance, these engineered T cells, the side effects are not hair falling out and mucositis and things. The side effects could be like overwhelming immune activation, and the kids get fevers and chills and have blood pressure issues. They could wind up in the ICU on blood pressure medicines and things. And it's that's actually a good sign. That means the therapy's working. But it is where we're kind of, you trade one set of side effects for a different set of side effects.
It's not like neatly tied up with a bow yet.
No, we don't have, there's maybe one disease where we're closest to that, and that would be chronic myeloid leukemia, where the drug imatinib or Gleevec, it's an oral medicine that you can take every day and will keep you in remission for years and years. An oral medicine that really doesn't have too many side effects because it is a very specific inhibitor. But I think that's our only story, kind of, I think that would kind of fit that description of few side effects, very well targeted, well tolerated, and not specific to a leukemia that has a very specific genetic change that can be targeted.